Good morning. I'm Stephen Lucas, Deputy Minister of Health Canada. We are here to provide an update on where we are and where Canada might be heading in the COVID-19 epidemic. Bonjour, je suis Stephen Lucas, sous-ministre de Santé Canada.
Good morning, my name is
Nous sommes ici pour faire le point sur notre situation actuelle et pour décrire où le Canada pourrait se diriger dans l'épidémie de COVID-19. We are taking an approach that uses multiple data and modeling tools, including models that we use to generate a number of future scenarios. Nous adoptons une approche qui utilise plusieurs données et outils de modélisation, y compris des modèles qui ont été utilisés pour générer un certain nombre de scénarios futurs. This briefing will share with Canadians our data and modeling and how they guide our planning and actions to control the epidemic and ready the healthcare system, working with provinces and territories. Durant cette séance d'information, nous partagerons avec les Canadiens et les Canadiennes nos données et notre modélisation et comment elles guident notre planification et nos décisions sur les mesures à prendre pour contrôler l'épidémie et préparer le système de santé en collaboration avec les provinces et les territoires. The briefing will be provided by Dr. Theresa Tam and Dr. Howard New, the Chief Public Health Officer and Deputy Chief Public Health Officer of Canada. La séance d'information sera fournie par la Dr. Theresa Tam, administratrice en chef de la santé publique, et le Dr. Howard New, sous-administrateur en chef de la santé publique du Canada. Following the briefing, there will be an opportunity to pose questions to Drs. Tam and New, supported by technical experts from the Public Health Agency of Canada. Dr. Nicholas Ogden, Director of the Public Health Risk Sciences Division, Dr. Ping Yan, Research Manager of the Modeling and Projection Section, and Dr. Rachel Rodin, Scientific Director and Senior Medical Advisor. Après l'exposé, il y aura l'occasion de poser des questions au Dr. Tam et nous, appuyés par des experts techniques de l'Agence de la santé publique du Canada. Dr. Nicholas Ogden, Directeur de la Division des sciences des risques pour la santé publique, Dr. Ping Yan, gestionnaire de recherche de la section de la modélisation et projection, et Dr. Rachel Rodin, directrice scientifique et conseillère médicale principale. With this, I'll turn to Dr. Tam. Sur ce, je me tourne vers Dr. Tam.
Dr. Tam, you have the floor.
Thank you very much. Good morning. Bonjour à toutes et à tous. So we're going to turn to slide 2. We are using data and models to guide our decisions. These models help us gain an understanding of where we are in the epidemic and where we might be heading. While models are imperfect, they do allow us to forecast infection and illness rates in the short term and explore the effectiveness of combinations of public health measures for controlling the epidemic. Models are highly sensitive to our actions. Data and models can help Canadians see how our individual and collective efforts, including staying home when possible, maintaining physical distancing, self-isolation, quarantine, and preventing the importation of infection, can determine the trajectory of Canada's COVID-19 epidemic. Models, especially at the provincial and local level, can help inform health system preparedness.
Bonjour. Diapositive 2. Nous utilisons des données et des modèles pour orienter nos décisions. Ces modèles nous aident à comprendre où nous en sommes dans l'épidémie et où nous pourrions nous diriger. Même si les modèles sont imparfaits, ils nous permettent de prévoir les taux d'infection et de maladies à court terme et d'étudier l'efficacité des combinaisons de mesures de santé publique pour contrôler l'épidémie. Grâce à ces données, les Canadiens pourront constater à quel point leurs efforts pour suivre les directives de la santé publique sont essentiels pour maîtriser l'épidémie de COVID-19 au Canada, notamment lorsqu'il s'agit de respecter les différentes mesures de santé publique comme l'éloignement physique, l'auto-isolement, la quarantaine et la prévention de l'entrée des cas en provenance d'autres pays.
This slide illustrates a very important concept. Our objective is to control the epidemic by reducing onward transmission through public health actions to push that blue curve down, while we build up healthcare capacity at the same time to push that dotted red line up. What we want to do is to keep the blue curve below that red line in order to reduce the overall total impact of this epidemic as fast as possible.
Diapositive 3. Cette diapositive illustre un concept très important. Notre objectif est de maîtriser l'épidémie en réduisant la transmission par les mesures de santé publique afin d'abaisser la courbe bleue, tout en renforçant la capacité de soins de santé. C'est la courbe, la ligne rouge. Le tout pour réduire l'impact tout global le plus rapidement possible.
Slide 4. So how do we make sure that epidemic dies out? Before strong public health measures were put in place in Canada, we estimated that each individual passed on the virus to just over 2 additional people. We have since taken a series of critical public health actions with testing and isolation of cases, contact tracing and quarantine, and Canadians are practicing physical distancing. These actions are helping to reduce the average number of people each case infects by breaking the chains of transmission to the point where each infected individual is transmitting the virus to less than 1 individual on average. The epidemic will die out.
Diapositive 4. Afin d'assurer la maîtrise de la première vague de l'épidémie, nous devons arriver au point où chaque personne infectée transmet le virus à moins d'une personne. Avant la mise en place des mesures de contrôle au Canada, chaque personne infectée avait transmis le virus à un peu plus de 2 autres personnes. Nous avons depuis pris une série de mesures de santé publique essentielles pour atteindre notre objectif de maîtrise de l'épidémie. Par exemple, le dépistage et l'auto-isolement des cas, la recherche des contacts et la quarantaine, l'éloignement physique et l'accroissement de la sensibilisation du public. Ces mesures, prises ensemble, sont essentielles pour briser la chaîne de transmission virale.
So, slide 5. In the next few slides, we're going to have a look at where we are with this pandemic in Canada right now. Next slide, slide 6. So this slide shows a snapshot of the epidemiology as it stands. And it is always evolving. So the number of cases or the case rates are different across Canada, and they are constantly evolving. The epidemiologic picture shows that there are regional differences, certainly with the bulk of cases in 4 provinces, British Columbia, Alberta, Ontario, and Quebec. All provinces and territories, though, are affected, with the exception of Nunavut, that has not yet reported a case. So we are also tracking severe outcomes, including deaths in long-term care facilities. We should note that these numbers are based on laboratory confirmed cases, but we know that it paints an incomplete picture, as many more cases are not formally detected or reported.
Diapositive 5. Maintenant, on va regarder l'épidémiologie et la situation actuellement au Canada. Diapositive 6. Le tableau épidémiologique au Canada continue de montrer que le plus grand nombre de cas se trouvent dans 4 provinces, la Colombie-Britannique, l'Alberta, l'Ontario et le Québec. Toutefois, l'ensemble des provinces et des territoires, à l'exception de Nunavut, signalent des cas. Il convient de noter que ces chiffres sont fondés sur les cas signalés en laboratoire. Mais nous savons qu'ils dressent un tableau incomplet car beaucoup d'autres cas ne sont pas officiellement déclarés. Nous avons également un taux élevé de décès dans les établissements de soins de longue durée.
So slide 7. The impact of the virus is local. Canada's cumulative case curve, which is in the black solid line, is an aggregate of a series of regional epidemics. Many factors, such as differences in the timing and pattern of community spread, For example, the timing of March break, or changes in laboratory testing, and the introduction of different public health measures on slightly different timelines can lead to regional differences.
Diapositive 7. On voit ici que la lutte contre le virus est locale. Des éléments tels que les différentes épidémiologies, l'instauration des différentes mesures de santé publique selon les calendriers légèrement différents, par exemple la semaine de relâche scolaire et les approches à l'égard de dépistage, conduisent à des réalités régionales différentes.
Slide 8. This slide compares how fast the epidemic is growing in a range of countries. For comparison purposes, each of the countries' curves are aligned to day 0, the day the country reached 500 cases. Canada's epidemic, which is the red curve, is in earlier stages. The line is shorter than others. There are then a series of straight dotted lines, which some of you may be able to make out, which speaks to the slope, and therefore the speed of the increase in cases. Canada's total case count have been increasing more slowly than most countries. We can see the number of cases are doubling every 3 to 5 days, which is comparatively a positive trajectory. Part of this is due to the learning we have taken from the experience of others and the approaches they have taken. This has allowed Canada to act earlier to control the epidemic.
Diapositive 8. Cette diapositive compare les vitesses à laquelle l'épidémie croît dans divers pays. On peut voir une tendance constante d'une accumulation de cas précoces au fur et à mesure que les pays commencent à mettre en place des mesures qui influencent ensuite sur la trajectoire de chaque pays. La clé est de se concentrer sur les lignes pointillées qui correspondent à la vitesse à laquelle les cas augmentent. Nous pouvons voir qu'au Canada, le nombre de cas double tous les 3 à 5 jours, ce qui constitue une trajectoire relativement positive. Le nombre total de cas au Canada a augmenté plus lentement que dans la plupart des pays. Cette situation est en partie attribuable aux apprentissages que nous avons tirés de l'expérience des autres et des approches qu'ils ont adoptées. Cela a permis au Canada d'agir plus tôt pour maîtriser l'épidémie.
I just want to add on this slide that the Canada's line is not a straight line upwards. As you can see, it's beginning to bend a little bit, which means that the growth rate is slowing down a little bit. So in the next series of slides, we're looking at our modeling scenarios. Slide 10. It's important to recognize that models are not a crystal ball and cannot predict what will happen. Models help us understand what could happen under various scenarios to allow us to prepare for the worst case and drive public health action to enable the best possible outcome. Models are used in public health to support decision-making on public health measures and to ready the healthcare system to plan for an expected number of COVID-19 patients. Nationally, we are using 2 modeling approaches, forecasting and dynamic models. In forecasting models, we use actual data on the cases we have seen in Canada to estimate how many new cases we may expect in the coming week. Dynamic models allow for a longer-term view using our knowledge, which is evolving, of how the virus behaves. It helps us look at different scenarios and the impact of public health measures taken over time. It is certainly important to recognize that all models have limitations.
Diapositive 9. Maintenant, on va regarder les scénarios de modélisation.
We're going to look at modeling scenarios.
Diapositive 10.
Slide 10.
Il faut bien comprendre que les modèles ne constituent pas une boule de cristal et ne permettent pas de prédire ce qui se passera. Les modèles fournissent des prévisions de ce qui pourrait se passer sous divers scénarios. Ainsi, ils nous permettent de nous préparer au pire et d'orienter les mesures de santé publique pour obtenir le meilleur résultat possible. possible.
best possible outcome.
Des modèles sont utilisés dans le domaine de la santé publique pour appuyer les décisions prises et pour préparer le système de santé en fonction du nombre prévu des patients atteints de la COVID-19. À l'échelle nationale, nous utilisons deux approches de modélisation, les modèles de prévision et les modèles dynamiques. Les modèles de prévision utilisent les données réelles sur les cas que nous avons connus au Canada afin d'estimer le nombre de nouveaux cas auxquels nous pouvons nous attendre dans la semaine à venir. Les modèles dynamiques qui reposent sur nos connaissances du comportement du virus nous permettent d'avoir une vision à plus long terme et nous aident à examiner différents scénarios et l'impact des mesures prises au fil du temps. Il est important de comprendre que les modèles ont des limites.
So on slide 11. So this is our forecasting model to look at the short-term epidemic trajectory. This slide illustrates three possible trajectories generated by this model, recalling that this kind of model is based on reported Canadian case data. Our forecast predicts that we will see from about 22,580 to about 31,850 cases by April the 16th. Based on the case fatality rate to date, this could mean we reach between 500 and 700 total deaths in Canada by next week.
Diapositive 11. Cette diapositive illustre trois trajectoires possibles produites par un modèle de prévision. Rappelez-vous que le modèle de prévision est fondé sur les données sur les cas déclarés au Canada. Selon nos prévisions, nous compterons environ entre 22 580 et 31 850 cas d'ici le 16 avril. D'après le taux de fatalité obtenu jusqu'à maintenant, cela pourrait signifier que nous allons atteindre entre 500 et 700 décès au Canada d'ici la semaine prochaine.
So on slide 12. So this shows the kind of method used by dynamic models. Dynamic models simulate the experience of individual people. So this is a novel virus. All people start as susceptible. Some will be exposed, and those exposed may become infected. These models also include different stages of the disease, from getting exposed, then infected, becoming symptomatic, and then maybe hospitalized, and then the patient recovers. Of course, there's also some serious health outcomes, including death. And modelers will use as much of the scientific information as possible, which changes over time, to populate the parameters for each of these stages of disease. So the consideration of all of these factors produces the modeling scenarios, and the different modeling scenarios produce different outcomes. We can also input measures that reduce the spread of infection, what we call mitigating factors, and others that could increase spread.
Diapositive 12. Les modèles dynamiques. Les modèles dynamiques simulent l'expérience des individus. Toutes les personnes sont considérées au départ comme étant des victimes potentielles. Certaines seront exposées et les personnes exposées peuvent être infectées. Les modèles tiennent aussi compte des différents stades de la maladie, soit l'exposition, l'infection, la manifestation des symptômes, l'hospitalisation, la guérison ou le décès. La prise en compte de tous ces facteurs donne lieu à des scénarios de modélisation. Selon le scénario de modélisation, on obtient un résultat différent.
So slide 13. So this is an important slide as it applies the kind of measures that we have been putting in place to date to see what happens to the models. So a series of models were synthesized to generate a number of scenarios, including no control, some controls to delay and reduce the peak, and stronger epidemic control measures. So from this, we can discern the range of the population infected, what we call the attack rate, and the potential duration of the epidemic. So stronger epidemic control models that you see at the bottom here on the green box, in the green box. These stronger epidemic control models include a high degree of physical distancing, a high proportion of cases identified, and a high proportion of contacts traced and quarantined.
Diapositive 13. Il s'agit d'une diapositive très importante puisqu'elle tient compte des mesures que nous avons mises en place à ce jour. Une série de modèles a été conçue pour obtenir un certain nombre de scénarios, notamment aucune mesure, mesure de contrôle plus faible pour retarder et réduire le pic et maîtrise de l'épidémie. À partir de là, nous pouvons déterminer la fourchette de personnes infectées et la durée possible de l'épidémie.
Slide 14. This slide illustrates the three possible scenarios that we just talked about. The red curve with a very high peak over a relatively short period of time is the no control scenario, or the worst case scenario, where the majority of the population could be infected. The blue line shows a scenario with weaker controls, leading to the delay and reduction in the peak. The green, smaller curve is the best case scenario in which we reach our objective of epidemic control. So this is a scenario we're working towards, where each infected person only transmits to less than one person. We can stay on this green curve by achieving high and sustained degree of physical distancing, and at the same time a high rate of case detection and self-isolation and contact tracing and quarantine.
Diapositive 14. Cette diapositive illustre trois scénarios possibles. Un pire cas, des figures où aucune mesure n'a été mise en place, c'était la courbe rouge. Un scénario de contrôle plus faible pour retarder et réduire le pic, c'est la courbe bleue. Et le meilleur des cas où nous atteignons à notre objectif qui est la maîtrise de l'épidémie. La stratégie collective canadienne à l'échelle nationale consiste à s'assurer que chaque personne infectée ne transmet la maladie qu'à moins d'une autre personne. Il s'agit de scénarios auxquels nous travaillons. La maîtrise de l'épidémie n'est possible qu'avec un degré élevé et soutenu d'éloignement physique et, en même temps, un taux élevé de détection des cas d'auto-isolement, de contacts trouvés et de quarantaine.
Slide 15. This slide shows the cumulative severe outcomes, critical illness resulting in death, for the three different scenarios. So in the green bars, that is the green small curve, that is the epidemic control scenario. The blue bars show the weaker controls, and the red bars show what happens when you have no control. And at the x-axis, you have the percentage of the population infected, and on the y-axis, the number of deaths. So these stock numbers tell us that we must do everything that we can now to remain in that best case scenario, to stay in the lower range of the green zone with strong epidemic control. Our collective efforts, despite all the hardships and the costs, is critical, as we must minimize the population infected, that's on the x-axis, in order to keep deaths, ICU admissions, and hospitalizations as low as possible. The resolve and the level of effort of all Canadians, from our healthcare workers on the front line to public health authorities, to all Canadians who are practicing physical distancing, will ultimately determine whether we can remain in this best case scenario and ensure that our health system can cope. We cannot prevent every death, but we must prevent every death that we can.
Diapositive 15. Cette diapositive montre le nombre cumulatif des cas graves, maladies critiques causant la mort, pour chacun des trois scénarios évoqués dans la diapositive précédente. Soit 1, ce sont les barres noires, aucune mesure de contrôle n'est mise en place. Deuxièmement, des mesures de contrôle plus faibles qui retardent et réduisent le pic, ce sont les barres bleues. Et le meilleur cas, la maîtrise de l'épidémie, ce sont en vert.
are in green.
Notre objectif est de rester sur la voie des meilleurs scénarios possibles,
Our objective
c'est-à-dire
is to remain
contrôler
on
l'épidémie
best case
de manière
scenario.
soutenue pour réduire au minimum les cas sévères et les décès.
The number of
Nos efforts collectifs,
deaths
malgré les difficultés et les coûts qu'ils représentent, doivent minimiser le nombre de personnes qui sont infectées
the number
et
of
aussi
people who are
hospitalisées.
infected and
Ceci gardera
hospitalized.
les décès au plus bas
This will
possible.
keep deaths
La
as low as
détermination
possible.
et le niveau d'effort
result,
de
the
l'ensemble des
level of effort
Canadiens,
of all
de nos
Canadians,
travailleurs de la
from our
santé en
healthcare
première
workers on
ligne,
the front line,
aux autorités de santé
public
publique,
health authorities,
en passant par tous ceux qui pratiquent l'éloignement physique, déterminera si, au bout de
show
compte,
that
nous pouvons rester dans ce meilleur
practice
scénario.
physical distancing,
Nous ne
we will be able
pourrons
to
pas prévenir
remain in this
tous les
best
décès,
case scenario.
mais nous
We
devons
cannot
prévenir
prevent
ceux que
every
nous
death, but
pouvons
we must
éviter.
prevent every death we can.
So slide 16. This shows our collective ambition across Canada, which is to achieve epidemic control, to not only minimize the cases and the severity of impacts, but to minimize the duration of that first wave. I just want to emphasize that even once we're past the peak of this first wave and on the downward trend on the other side of the curve, it will be equally critical to keep up with our control measures. If we let up, new chains of transmission will take off in our highly susceptible population, and the epidemic will reignite. If we are to not lose our hard-won progress, we must stay the course until we have reached a very low number of cases at the bottom of that first wave. However, even with epidemic control, we anticipate that some public health measures will need to remain in place to prevent the growth of future smaller waves.
Diapositive 16. Notre but.
Dr. New, slide
Le scénario qui représente le meilleur cas de maîtrise de l'épidémie peut réduire la gravité à la durée de l'épidémie, et c'est ce que nous visons. Il est essentiel de maîtriser rapidement l'épidémie pendant cette première vague. Toutefois, même avec une maîtrise de l'épidémie, nous prévoyons qu'il faudra que certaines mesures de santé publique devront rester en place pour prévenir la croissance de petites vagues à venir. De plus petites vagues à venir. Si nous ne voulons pas perdre les progrès réalisés, il faut garder le cap jusqu'à ce que nous atteignions de très petits nombres de cas. Même une fois que nous aurons passé le pic de l'épidémie et que nous sommes sur la pente descendante de la courbe, il sera tout aussi critique de maintenir nos mesures de contrôle. Si nous relâchons nos efforts, de nouvelles chaînes de transmission se déclencheront dans notre population hautement susceptible et l'épidémie se ravivera.
So on slide 17, so what do we need to do now to determine our future? Next slide, slide 18. So to keep on that green curve, we have to continue to implement the public health measures we have put in place. We have to keep an eye on that trajectory to see if increased measures are needed, so that we can continue to aim for the lowest possible infection rate to both minimize illness and deaths and to shorten the duration of the epidemic. We have to prepare our health system to expand our health system capacity. Recognizing that even if successful, some public health measures need to be sustained to reduce both importation and domestic transmission. The epidemic is not the same in all parts of the country, so the control measures will have to be readjusted depending also on the local epidemic situation. It is too early to know how close we are to the peak from a national perspective. However, we are discussing with all chief medical officers of health what more should be done to keep us on the path of epidemic control. Once we've observed significant progress in getting the epidemic under control, we will still need to have highly sensitive testing in order to alert us to any new cases occurring so that we can trace and stamp out any chains of transmission quickly.
Diapositive 17. C'est quoi notre
Dr. New, slide
stratégie?
17.
Diapositive
What does
18.
our strategy look like?
continuer à mettre en œuvre les mesures en place, surveiller la trajectoire pour voir si des mesures accrues sont nécessaires pour continuer à viser le taux d'infection le plus bas possible afin de réduire au minimum la maladie et les décès et de raccourcir la durée de l'épidémie. Reconnaître que même si elles connaissent du succès, certaines mesures de santé publique doivent être maintenues pour réduire à la fois l'entrée de cas et la transmission de la maladie au pays. L'épidémie n'est pas la même dans toutes les parties du pays. Conséquemment, quand les mesures de contrôle peuvent être assouplies, les décisions seront basées sur la situation épidémique locale. Il est possible que certaines régions pourront assouplir certaines mesures pendant que d'autres régions du Canada ne pourront pas. Il est encore trop tôt pour savoir à quel point nous sommes près d'atteindre le pic à l'échelle nationale. Cela dit, nous discutons avec tous les médecins hygiénistes en chef au sujet des mesures supplémentaires à prendre pour que nous demeurions sur la voie de contrôle de l'épidémie. Une fois que nous aurons observé d'importants progrès dans la maîtrise de l'épidémie, nous devrons tout de même procéder à un dépistage efficace pour détecter tout nouveau cas afin de repérer et d'éradiquer rapidement toute chaîne de transmission. Nous reviendront dans les prochaines semaines pour faire une mise à jour sur notre progrès une fois que l'impact de nos mesures de contrôle devient plus évident.
Slide 19. So in conclusion, while some of the numbers released today may seem stark, Canada's modelling demonstrates that the country still has an opportunity to control the epidemic and save lives. We cannot prevent every death, but we must prevent all the deaths that we can. We all play a role in what the future will hold for Canada's COVID-19 trajectory. We must continue to control the epidemic using tried and true public health measures, including asking every Canadian to stay at home whenever possible, maintain physical distancing, meticulous hand washing, and cover our coughs. What we do together now to stop the spread of COVID-19 will reduce the impact of the epidemic and determine how soon we can readjust our public health measures. What we do together now will buy us more time to further understand the virus and to develop treatments and vaccines. We are the authors of our fate. Together we can plank the epidemic curve.
Diapositive 19. Bien que les chiffres publiés aujourd'hui peuvent sembler sombres, la modélisation du Canada démontre que le pays a toujours la possibilité de contrôler l'épidémie et de sauver des vies. Nous ne pouvons éviter chacune des morts, mais nous devons prévenir toutes celles que nous pouvons. Nous jouons tous un rôle dans ce que sera la trajectoire de la COVID-19 dans l'avenir. Nous devons continuer de contrôler l'épidémie en prenant des mesures qui ont fait leur preuve, comme par exemple en demandant à chacun des Canadiens de rester à la maison, de garder une distance physique avec les autres, de se laver les mains méticuleusement et de couvrir leur bouche lorsqu'ils toussent. Ce que nous faisons ensemble maintenant pour arrêter la propagation de la COVID-19 réduira les répercussions de la pandémie et déterminera dans combien de temps nous pourrons redresser nos mesures de santé publique à une nouvelle normalité. Ce que nous faisons ensemble maintenant nous fera gagner plus de temps pour mieux comprendre le virus et développer les traitements et des vaccins. Nous sommes les auteurs de notre sort. Ensemble, nous pouvons aplatir la courbe. Merci.
Thank you, doctors. We will now open the telephone line and the floor to questions. Vous pouvez poser vos questions dans les deux langues officielles. We ask that you limit yourself to one question and only one follow-up. We'll take 3 questions from the phone. For those asking questions in the room, we also ask that you make your way over to the freestanding mics. Over to you, operator.
Merci. Alors, au téléphone, si vous voulez poser une question, faites étoile 1. There will be a short pause while the participants register. Courte pause pendant que les participants s'enregistrent.
There will be a short pause as participants register.
The first question is from Marika Walsh from the Globe and Mail. Please go ahead.
Hi there. Thank you. Dr. Tam, I'm wondering if you can just articulate for us specifically if we need to be doing more than what is already in place publicly to get to this sort of green area where between 11,000 and 22,000 are predicted to die, or if we are already doing everything that needs to be done?
Well, I think in the last weeks, a lot has been done. And we will need to monitor every single day the evolution of the outbreak and the trajectory so that we can recalibrate as needed. So depending on where that curve is bending downwards, or if we need to do more in order to ensure that that is what's happening. So it is a pretty dynamic process. However, we are trying to improve on every aspect of our response as we speak. For example, we are doing a number of efforts, different approaches to enhance our lab testing capacity, for example, right now, because we know that a key part of our staying on course for that green zone is to ensure that we are detecting cases and we are managing contacts. So we're learning from across the country how best to do contact tracing, trying to enforce the human resources that might be needed to do that, looking at whether technology can help with contact tracing. These are all happening right now and supporting people in self-isolation. And so, but the short question is, yes, we will continue on all of these fronts to just make sure that we stay on course, but we really got to look at this dynamic situation every single day as we speak.
And if I could have a question, I just wanted to understand with Ontario, if are they doing those really strong?
Ms. Wash, I cannot hear you.
You're cutting off, Marika. Can you just repeat your question, please?
Yeah, can you hear me now?
Yes.
I'm wondering, for example, with Ontario, do you see Ontario doing these really strong measures that you're talking about as being needed, given that they have the lowest testing, for example?
Well, I think, as you've seen, a whole series of briefings from Ontario stepping up all of their measures. And so I think we are here to support our National Microbiology Lab and the agency, Health Canada. Other departments actually are ramping up to make sure we can escalate our laboratory capacity in this country as a whole. So we will be supporting Ontario whenever the need arises.
Next question, operator.
Thank you. Prochaine question, Hélène Buzetti, Le Devoir.
The next question is from Hélène Buzetti from Le
Yes,
Devoir.
Dr. Tam, I'd like to go back to slide 15. First of all, I'd like for you to clarify the time frame for those deaths. Are we talking about until the end of April or until the end of 2021? And also, I'd like you to reconcile those numbers because we know that Quebec is the province where there are most cases, and yet when Quebec released its own numbers, its own projection last week, its best case scenario was 1,200 deaths, and now you're talking about 11,000. So I have a hard time reconciling both.
Yes, so of course each jurisdiction will use a combination of different modeling for their own planning purposes. And as I say, these are different scenarios, so they may be using slightly different parameters for their numbers as well. But of course, as I said, at the national level, we're really an aggregate and composite picture of all the different regional and provincial outbreaks. So certainly Quebec will use their real-time information to adjust their modeling as needed as well. So in terms of the timeframes, so the heading of this slide is that over the course of the pandemic. But if you sort of look back one slide before that, which is slide 14, you can see that the duration of the course of that wave is actually a bit different for the different scenarios. So if we achieve stronger epidemic control and we only get, for example, 1% attack rate, the 1% attack rate, or 2.5% or 5%, that is spread out underneath that curve. So the number of cases in each of those scenarios spread out under that curve over a slightly different time frame for each of those scenarios. Some of these time frames, for example, for the weaker controls, you can see that you get a lower attack rate, but it's spread over a longer period of time. So the time frame is over the course of that wave.
And as a follow-up, I think you mentioned it in your presentation, but when do you expect the peak to happen? Can we talk about it nationally? Because I know in Quebec they talked about 18th of April. In Alberta, I think they talked about mid-May. Is there a peak? Is there such a thing as a peak date for Canada?
Well, Canada, as I've said, our epidemic curve is a composite then of all the different curves in the different jurisdictions. So for sure, we need to look very carefully at each of the provincial trajectories on top of the Canada aggregate. So I actually think the aggregate Canadian curve really doesn't tell the complete story. You do have to break it down into the different provinces and territories. What I will say is, of course, we're looking for signs of that bending of that curve, the slowing down of that growth rate. But because of, as I've mentioned always, the delay in when someone got infected to the time that they are diagnosed, tested, and reported, that could be a space of at least 2 weeks. And during that time, you have to be really cautious. You don't actually know the peak until you've passed the peak. That always happens. You can't tell whether you've reached the peak until after the peak had actually been realized. And so I would just take it a day at a time and look very carefully in the coming weeks. I've said in some areas of the country, this week is very important, the next week is very important. That timing of when that peak might occur can occur at different times in different parts of the country. As I said, what I really want to emphasize is that even if you're seeing some bend and that peak retrospectively occur, the downward slope, if you look at the downward slope, there's 50% of the cases, if that's a symmetric curve, still occurs on that downside of the slope. You cannot let go of those public health measures if you see that downturn.
Thank you, Doctor. Next question.
Thank you. Merci. The next question is John Edison, the National Post. Your line is open.
Dr. Tam, presumably you've ruled out the 70%, 80% infection rate. But where do your forecasts suggest we are on that graph? Are we at 25%, 50%, or even 10%?
The answer actually is we don't know. We are at the fairly early on. Canada is in our epidemic. So right now, we have, think as of today, the numbers will change. Say 20,000 cases. We may have, even if you double that number, we're at 40,000 cases. But that's only when you're starting that epidemic curve. And the more that we can do now, the smaller number that would be. And so, again, these models are very sensitive to our actions. And so we can't actually say. All I can tell you is that we stand a really good chance of absolutely staying in that green zone if we try and continue everything that we're doing now.
Okay, thank you.
So now we'll turn to the room. We'll start with Julie and then Glenn.
Sorry. Okay, here we go. Sorry, Julie Van Dusen, CBC. Can you give us a rough idea from all your modeling exactly, we've all been living under restrictions for weeks. When do you think the tightest restrictions will be lifted? And how can that even happen unless all Canadians are tested? Because many might be walking around with no symptoms, infecting each other, even when the restrictions are lifted.
I think that is the question that most Canadians are probably asking right now. So again, we don't know if we've reached a peak anywhere in Canada as yet. So it is too early to tell, and we've got to really look very carefully day by day at where the trajectories are going in different parts of the country. We will not know that we've passed the peak until retrospectively we will know. On the downward side on the curve, we cannot let go of any of our public health measures. The moment you release anything, the chains of transmission is going to ignite. So you're going to have to get that initial epidemic to die out, to stamp it out. And so at the end of which, things have to be recalibrated. So as I said, we are going to look towards countries that have gone before us to learn, if they are beginning to relax their measures, what they might be doing and learning from their experience. At the same time, I think right now is a period of time when across the country we're coming together to say, well, how do we determine the effectiveness of our public health measures? How do we determine the potential negative consequences of the measures that we've already taken? And then how do we very cautiously potentially lift some of them, depending on our data and what that shows at that time? All I can say is that it will be a very cautious approach because right now the population is susceptible. So anything that we do must not reignite another chain of transmission. So, I can't be extremely precise with the timing of that. But again, everything that we do now will shorten that period of time.
So doctors, your message has been for days now, stay in your bubble. And we know not everybody's staying in their bubble, including anecdotally, we hear boyfriends going to see girlfriends that live at different houses and so on. This weekend's going to be a huge test. We're heading into a holiday weekend. Do you have any advice? What will you be doing? People are going to want to get out of their bubbles and go into other people's bubbles.
It is difficult for everyone living in Canada. We're not used to some of these behavioral changes we're asking every Canadian to take. But I think if you can put in that image in your head of what could happen, the really severe consequences that can happen if we don't all do our part. So staying at home, only having dinner and religious observations with your immediate family members, don't invite other family or friends over, is extremely important. We are in a very critical time period. But just remember what could happen if we don't try really hard at this time. And I think practicing physical distancing outside as the weather improves, people will be wanting to go out, but maintaining that 2-meter distance. Of course, I think there's some innovations. There are different innovators with applications, for instance, that tries to nudge people to do the right thing. Feedback from a number of studies, for example, even the Google study that shows a reduction in mobilization movement of people, I think should be a great stimulation to say, look, Canadians, we've done actually pretty well. We've restricted movement quite a bit just based on what Google has been telling us in terms of mobile phone and movement data, for example, but we can do better. And so studies like those helps us sort of look at them and go, okay, well, we can reduce our movement and stay at home as much as possible. But it is a matter of life and death, really. And when I say, we are the authors of our fate, this is something that is really serious, and every Canadian should do our utmost. And we know we can. We're a resilient group of people. We want to protect others. So I think, everybody will be doing their best.
I'll just add to that sort of a personal example from myself. We're going to have a virtual Easter. I have 3 children. One's in Ottawa. She's a university student. She knows she's out there. And she hasn't been living at home with us since this began. And my 2 boys are in Quebec. They're in Montreal, actually. So we have lots of great video conferences, and we'll plan to have a virtual Easter over dinner, over a webcam. Pardon me? Of course it's hard. We're used to having family gatherings. It's a great tradition that we have, and I think lots of families across Canada. But we know that these are extraordinary times. My children understand that. My partner, myself, we're in our own bubble at home, and the kids, they recognize they need to be in their bubble.
Thank you, Glenn.
Glenn McGregor, CTV News. On chart 15, it specifies the number of deaths only for two scenarios between 2.5% infection rate and 5%. Just wondering if you think that's the range we're in now. So those are kind of based on what we're doing. That's the best and worst case scenario if we keep doing what we're doing now. And secondarily to that, in the very best case scenario of a 1% infection rate, is that attainable? And if so, if you use that same death rate, that would still mean 4,400 deaths by my calculation. Is that kind of the absolute best scenario?
Again, all of these scenarios are scenarios, and they're very sensitive to the action that we have right now. I think the 2.55% is the sort of mid-range of that best, strongest epidemic control scenario as an illustration of the kind of numbers that you will get if you put these scenarios through this range. And I think, looking at 2.5 to 5%, it's just, they are just scenarios. But I think looking at those range helps planning from a health system perspective. I think that attack rates or the percentage of populations infected beyond those ranges will mean that the health system will find it really difficult to cope. So what we want to do is to stay under that kind of trajectory.
Okay. These models are based on what death rate exactly? Because that's kind of a guess because you don't know the total number of people who are infected, correct? So I wonder if you could talk about how that rate was calculated and whether or not you factored in Canada's level of health care compared to somewhere like China or other places in Asia that may not have as good intensive care systems.
Yes, so the dynamic model that we talked about will input a variety of those factors, the mathematical calculations, and different ranges of sensitivity around each of those numbers. And even our case fatality, or what we call the sort of crude case fatality at this time will vary. And I have to point out that on the epidemiology slide, I did say that a great proportion of our deaths, unfortunately, are linked to long-term care facilities. So understanding what those deaths are tells us what to do to improve our final outcome. So with that population being quite severely impacted, you're seeing a current case fatality of around 2%. But the modelers, some of whom are on the phone, will have parameters and sensitivity and a range that will input to give us some of those measures. Yes, so if you're seeing clusters concentrated in older population, you're going to see a higher fatality. If you look at the Canadian population in a more homogeneous way, of course, that may reduce that. So the models will look at the dynamics of transmission as well. I don't know if Dr. Ogden will want to add anything.
Well, I would just note that those models and the specific parameter in terms of death rate are informed by international studies and work in Canada by our modelers at the Public Health Agency and the network of experts across the country they work with from both provinces and territories and academia.
Thank you, Maura.
Yeah, thank you, Maura Forrest, Politico. I just wanted to get back to this question of 11,000 to 22,000 deaths. I just want a bit more clarity about how we should talk about these numbers. These are the numbers we're all going to latch on to because they're the only numbers that you've provided here. We're all going to report those numbers. So how do we write about those? Is that sort of the most likely scenario at this point? Is that the most optimistic scenario at this point? Like, why did you only provide those figures?
Well, I think we can certainly provide a whole range of figures. These were selected in the middle of that strong epidemic control range, but also to illustrate how severe the outcome could be in those scenarios, even if we, of course, put in a lot of strong epidemic control measures. And where we end up in that range will again depend on the actions that are taken. So they are there to illustrate what the output is for the 2.5% attack rate, or the percentage population infected, and the 5% population infected. And as I've said, that is actually over the course of that whole epidemic wave. The other kind of modeling that particularly happens at the provincial level is to model the shape of that wave and look at that very peak of that curve, because you want to make sure your health system and all of its measures are below that peak. So that's how we interpret it. But as you can imagine, it's not that difficult to sort of project it. In the bars, you can't really read very well, but they do give you that whole range of numbers as you sort of move up the curve if you actually slide yourself across to that y-axis. But this is used as illustration, but as I said, round about that 2.5% population infection rate is the point at which the healthcare system could be very pressured in terms of its response. So, looking at that range is actually quite important.
And you also mentioned that the rate of growth is slowing. Does that mean that we are successfully flattening the curve right now?
Well, I think all chief medical officers are trying to be extremely cautious about the interpretation, because it doesn't take much if someone relaxes or don't perform as well in some of those public health measures. But what we are seeing is in the composite curve, with all the provinces added together, we are slowing down in our growth. So we are currently between the sort of doubling time of every 3 days to every 5 days. It's actually veering towards a doubling time of every 5 days. That is what we're observing. But we will be monitoring that really closely.
Thank you, Doctor. Let's go back on the phone. Operator, please.
Thank you. Merci. La prochaine question, Lina Dib, La Presse canadienne. À vous la parole.
The next question, Lina Dib.
Oui, bonjour. I'd like to go back to numbers again and slide 15, please. So can you give me the numbers for that green scenario, the 10%, the number of cases, the number of hospitalizations, the number of intensive care, and the number of deaths?
We can certainly provide those numbers for those stronger epidemic control scenarios. I would just emphasize that in looking at this, it's important to remember, as Dr. Tam noted, that we have strong epidemic control measures in place, that we want to stay in the lower range of the green zone with those stronger epidemic control measures. And we are the authors of our own fate in terms of taking collective action to ensure that we guide that future to the best possible outcome.
So can I have the numbers, please? I'm still waiting for the numbers. Can you give the numbers? And can you tell me if you consider that now we are in this green zone of controlling the epidemic? So can you give me the numbers for the 10%? Because I can calculate the percentage of cases, but I can't infer the hospitalization numbers or the intensive care numbers or the deaths.
We will certainly work to provide those numbers in a very short term.
We can follow up with you after, Lina.
Mais voyons. I thought this was a briefing. This is what this is supposed to be for.
It's Dr. New. Maybe I can answer that. Is that certainly with our modelers, there's a wide range of parameters that go into the modeling, as you can appreciate. That it's very sensitive depending on what kind of sort of percentages you put in. So, for example, we're looking at attack rates. So over the whole course of the epidemic, we're estimating in a best case scenario that 1% of the Canadian population will become infected. So if you look at the Canadian population of 37 million, obviously you see that the figure there would be about 376,000. And of course, we estimate that over quite a number of months, not all at once. So that could be over even a year or so if we do our best efforts and continue our public health measures like physical distancing. If you're looking at hospitalization, there's quite a wide range. I could give you a figure. It's a certain percentage. If you look at the data we have to date, it's quite a bit lower. I would certainly about 6-7% or so is the kind of estimates we've seen and the data that gives us a rough idea of what we might expect. And then, of course, data from around the world, plus our own experience in Canada, shows us what kind of percentage or what the number of people that might end up needing an ICU bed, and of course, in the worst-case scenario, a ventilator. But you can see that in Canada, we don't have that much data yet that's reported up to national level. And so the data is very sensitive, and therefore, not to, let's say, give you numbers that could change the next day and also alarm people unduly. Where we're still, in a sense, at this point, getting the data from the provinces. We recognize there's a delay, and maybe at a future point, we'll be able to give you more precise figures. But that's the nature of modeling.
So just to help you do some, all of us do some simple arithmetic. If you see the 2.5 to 5%, you're multiplying those numbers by 2. So you can imagine if you want the 10%, what you do, for example, hospitalization. For the 10% scenario, you multiply 146,000 by 2. So that will be like 292,000. So that is how we will be able to give you those numbers. Does that help?
Yes, thank you.
Thank you.
Approximately 2%.
Thank you. Next question.
Merci. La prochaine question est de Christian Noël, Radio-Canada. À vous la parole.
Radio-Canada.
Bonjour à tous. Je comprends un peu ce qui se passe. Les Canadiens aimeraient ça aussi comprendre ce qui se passe et comprendre quelle est votre meilleure évaluation. À quel moment le pic pourrait survenir, au plus tôt et au plus tard, dépendamment des modèles. Quelle est votre meilleure évaluation de ça? Et basé là-dessus, combien de temps les mesures de distanciation physique pourraient durer? Le graphique semble suggérer jusqu'à 1 an. Donc, quel est le plus tôt et le plus tard? Donnez-nous quelque chose de précis pour que les gens comprennent qu'il y a une mesure. Là. Le pic et la distanciation, le plus tôt, le plus tard que ça va durer.
Merci pour la question. Voici Dr. New. C'est difficile à prédire quand va arriver le pic parce que avec une courbe épidémique, on ne sait pas quand on est arrivé au pic parce qu'il faut avoir la pente descendante. Parce que c'est seulement après les semaines après le pic, on peut, comme il dit, aussi regarder et c'est maintenant, on savait que le pic était il y a 2 semaines parce que maintenant, on est sur la pente descendante. Donc, c'est difficile à ce moment, mais avec nos modèles, on peut prévoir que si on fait nos meilleurs efforts avec la distanciation sociale, tout ça, la première vague, peut-être, ça peut être fini peut-être en été. Ça, c'est le point numéro 1. Pour l'autre point pour la pente descendante, si c'est vraiment symétrique, on sait que même 50% des cas peuvent arriver après le pic. Donc, c'est important de ne pas lâcher tout ce qu'on fait jusqu'à date, les mesures de santé publique, la distanciation physique. Il faut continuer, pas lâcher, pas dire que, après le pic, OK, on est sur la pente descondante, tout le monde peut lâcher, on peut rassembler encore. Non, ce n'est pas la chose importante. Donc, l'autre aspect aussi, on a montré que même après la première vague, on attend aussi peut-être même les petites vagues. C'est vraiment, il faut être vraiment prudent et c'est au fur et à mesure. Et aussi, c'est parce que l'épidémie au Canada, c'est pas comme une épidémie, une grande épidémie, c'est vraiment des épidémies locales dans chaque province et territoire. Ça veut dire que, dépendant de la courbe épidémique, qu'est-ce qui se passe actuellement aux provinces et territoires, on peut voir peut-être au futur qu'une province peut-être mettre en place des mesures, peut-être lâcher un peu des mesures de distanciation physique un peu plus tôt avant une autre province ou territoire, parce que pour eux, ils sont dans un autre point dans leur propre courbe épidémique. Merci. Est-ce que
Ça répond un peu, donc, si je comprends bien, dépendamment des provinces, c'est possible que les mesures de distanciation physique continuent jusqu'au mois de décembre.
Oui, on continue avec nos meilleurs efforts maintenant. C'est vraiment pour aplatir la courbe. On attend, on espère que la première vague, c'est quelle diapositive, je pense, je n'ai pas devant moi, diapositive 16, peut-être, c'est peut-être jusqu'à l'été. Mais c'est pas fini, c'est pas la fin de l'épidémie. On attend encore les petites vagues. Et c'est pourquoi c'est difficile maintenant, même à l'échelle nationale, de vous donner, OK, à cette date, on peut lâcher toutes les mesures déjà mises en place par chaque province et territoire. Vraiment, à l'échelle nationale, c'est une somme des épidémies de toutes les provinces et territoires. Donc, je pense que c'est mieux si on parle du Québec, de vraiment demander aux autorités du Québec qu'est-ce qui se passe actuellement. Ils ont déjà leur propre modèle, ils ont donné comme une prévision, mais c'est aussi pour les personnes, toute la population du Québec, de vraiment aussi garder le cap et on verra qu'est-ce qui se passe dans les semaines prochaines.
Si je comprends bien, c'est pas exclu que des mesures de distanciation physique durent jusqu'au mois de décembre.
Pour les mesures de distanciation physique, maintenant, on est vraiment, comme on dit, sévère au fur et à mesure dans chaque province et territoire. Et moi, je dis que c'est vraiment pour chaque province et territoire pour suivre leur propre épidémie et au fur et à mesure, si on a peut-être évidence qu'on est sur la pente descendante, peut-être on peut lâcher un peu, mais c'est vraiment aux autorités de chaque province et territoire de décider c'est quand le bon moment. Et aussi, à part de ça, c'est aussi très important d'avoir un système de surveillance et aussi de la capacité laboratoire pour bien détecter vraiment rapidement s'il y a encore des foyers. Parce que s'il y a un délai, on ne peut pas voir qu'est-ce qui se passe actuellement si on lâche quelques mesures et on a peut-être on remonte peut-être avec les cas.
Question by Julie Van Dusen in the room
What we're hoping, obviously, is we put our best foot forward, that everyone, all the provinces and territories, the Canadian population keeps at it right now. This is the critical time, especially, as you say, with important holidays coming up, such as Easter and Passover, Ramadan, and so on, that everyone recognizes the importance that even though there are important traditions, this is not the time to have your family get-togethers. As I mentioned, even personally, I'm having a virtual Easter with my family. If our best efforts are successful, then possibly, hopefully, the first wave will end by the summer. But it's not over. Certainly with that first wave, as I mentioned, you won't know if you've reached a peak until actually you're on the downward curve, because it's almost like retrospectively that you'll be able to see that you're on the downward curve. And after that, we certainly anticipate there will be smaller secondary waves. We've talked about second, third, fourth waves, and therefore it's very important to keep at it. One of the key things that needs to happen across the country is that we need to maintain a strong surveillance system and a laboratory system that's able to test, as you put it before, widely in the population. Because if we start, and this is really at the provincial and territorial level, let's say relaxing, if you can put it that way, in terms of certain measures, in terms of physical distancing, because they're on the downward curve, you have to be able to detect very rapidly if cases then pop up again, little outbreaks and so on, because then you might have to adjust as you go on. So it's a very, I think, cautious approach in which each province and territory, even not a province as a whole, but individual regions, cities, and so on, need to look at their local epidemiology, look at what measures are in place, as hopefully we say as a country or in each region, as the epidemic curve looks like it's on the downward trend, have that sort of a good analysis to see, okay, what can we do to maybe relax certain things? One of the things we've also mentioned is that it's critical, besides a good surveillance system and laboratory capacity, that we need to do our best efforts to protect our most vulnerable populations. So what's been happening in nursing homes and so on, I certainly can see very strict measures still staying in place in nursing homes, in other settings, congregate settings, that certainly if you were to get an introduction or reintroduction of the virus, it could have catastrophic results. So those are some of the key aspects. I'm not going to put a summer, and the thing is, depending on which part of the country, British Columbia, I think it would be considered a perpetual summer compared to the north. It's not for me to say. I would say that sometime in the summer, and that it may vary by several weeks depending on what part of the country. I think most people in Canada know that certainly for summer vacations, July and August seem to be our peak months for summer in terms of taking a vacation.
I'd like to just provide further elaboration on the information on slide 15. These scenarios are modeled on the basis of understanding the transmission of the disease. They're not driven by data, but rather by understanding how the disease is transmitted and the control measures in place. From those, we can determine the percentage of the population infected, as noted on slide 14. With that, we can mathematically determine, based on information obtained internationally and in Canada, as I'd noted, the number of hospitalizations, the number of potential people in ICU, and the number of deaths. In that regard, over the cumulative span of the pandemic, the assumption is that 8% of the cases would be hospitalized, 2.4% of the cases will need care in ICU, and the case fatality rate is 1.1%. The earlier comment I made about 2.2% is the observed rate of fatality today based on the number of cases. So I just wanted to clarify that point. And based on those numbers, the range of deaths is from 4,400 in a 1% strong control measure, that's where we want to be or better, through to 44,000 in the 10% scenario. As I noted, and Dr. Tam emphasized in her briefing, we have strong control measures in place now. We want to stay in the lower range of the green zone of stronger control measures, because that has the best possible outcome for Canadians. And indeed, we are the authors of our own fate, and the actions that we will take collectively will work to help keep us in the green zone to the best possible outcome.
Thank you. We'll do one last question on the phone, operator.
Thank you. Merci. The next question, la prochaine question de Mélanie Marquis, La Presse.
The next question from Mélanie Marquis from La Presse.
Merci. Dr. Tam or Dr. Arnoux, can you speak to the Quebec curve, how it seems to be much more a problematic situation over there? How can we explain that, that the numbers are so much starker in Quebec than in the rest of the country?
Yes, so I think you're speaking to slide number 7.
Hold on.
Yes. Is that correct?
Yes, I am. Yes.
Mm-hmm. So, so in terms of Quebec, there may be a range of factors. One is that, of course, Quebec is testing a lot of people. At some point in this trajectory, as you can see, there was quite a sharp increase as the testing also accelerated. We know Alberta and Quebec are testing at a very, very high rate, and so are a number of the other jurisdictions as well. But they are experiencing a different outbreak to others. For example, they experienced the March break earlier than the rest of the population at a time when people were still taking vacations overseas. Right now, we have advised against all non-essential travel, and with a lot of other travel measures and advisories and the prevention of foreign nationals, for example, is coming to Canada. So I believe that some of those dynamics, like the March break returnees, also contributed to Quebec's, upward trajectory at that time. So I think it's a combination of the actual epidemiology and the transmission in that province, together with testing strategies. But the key is that you can then observe, once things stabilize, you can observe that curve and see what happens to it. So each individual curve you can then follow and see what that slope might look like over time.
C'est Dr. New, seulement pour aussi ajouter que ce que Dr. Tam a dit, que je pense, d'après moi, le Québec a fait vraiment un bon job pour dépister et tester la population. Donc, on sait toujours qu'avec les courbes épidémiques, c'est peut-être une sous-estimée de la réalité parce que c'est seulement les cas qu'on a détectés, testés et signalés. Et je pense que c'est un peu artificiel parce que le Québec a fait un très bon job pour dépister les personnes au Québec. Et aussi, comme Dr. Tam a dit, que le relâche scolaire au Québec était un peu plus tôt que les relâches scolaires dans les autres provinces et territoires.
Question suivie.
Merci, monsieur. Oui, monsieur Nous, je voudrais juste revenir sur la question de mon collègue par rapport à la durée à laquelle on peut s'attendre pour la distanciation sociale. Sauf erreur, ça pourrait durer jusqu'en décembre. Je ne suis pas certaine d'avoir bien compris.
Based on my understanding.
OK. Comme j'ai dit avant, que si tout le monde, même au Québec, tout le monde continue avec les meilleurs efforts pour garder la distanciation physique, aussi les autres mesures de santé publique, les consignes, il faut vraiment suivre les consignes des autorités de santé publique au Canada et aussi au Québec. On attend peut-être que la première vague, peut-être que ça va durer jusqu'à l'été. Mais c'est sûr que l'épidémie ne sera pas finie au Canada parce qu'on attend aussi, comme on dit, les petites vagues après. Donc, je pense que c'est vraiment une question que les autorités, en suivant de très proche leur propre courbe épidémique, au fur et à mesure, et peut-être qu'ils peuvent légèrement peut-être lâcher quelques mesures en attendant peut-être les prochaines petites vagues. Mais pour faire ça, c'est absolument important de garder, d'avoir un bon système de surveillance et aussi la capacité laboratoire pour dépister parce qu'il faut rapidement signaler s'il y a peut-être une éclosion des autres cas qui peut-être qui peut monter dans une autre petite courbe épidémique avec les autres petites vagues. Donc, ça, c'est une chose à suivre et c'est sûr que tout le monde veut lâcher complètement, mais je pense que Dr. Tam et moi, nous sommes d'accord avec tous les autres médecins hygiénistes en chef des provinces et territoires. Il faut vraiment avancer prudemment selon l'évidence scientifique aussi les données probantes.
OK, comme l'été, c'est jusqu'à la fin de l'été.
Oui,
parce que l'été, c'est 3 mois.
The end of the summer, then.
Go ahead.
Oui, on voit sur la diapositive que la première vague, oui, on espère avec nos meilleurs efforts maintenant que peut-être la première vague, c'est jusqu'à l'été.
Or we can see that it will last until the summer. Question from Julie Van Dusen in the room, inaudible.
It's difficult to say because every province and territory, even at a very local level, has their own, what we call their own epidemic. So depending, let's say, for example, if you were, let's say, in a community, and I'll exaggerate the point, that has a very, a high proportion of seniors and maybe quite a number of nursing homes, the way you might go forward in terms of the measures that you might either keep in place or sort of slowly relax would be much different from, let's say, another part of the country where maybe the communities are more spread out. Maybe the population density is different. So there's so many factors in play that's difficult to say in general, especially at the national level. Oh, yes, at this state, all of Quebec or all of Ontario or whatever province, Alberta, etc., could let go of measures in totality because you really have to do it at a very, granular or local level.
Thank you. This is all the time we had for today. Please note of the next press conference at noon today. C'est tout le temps qu'on avait pour aujourd'hui. C'est ce qui m'a fait un briefage technique. La prochaine conférence de presse au point de presse sera à midi aujourd'hui.
Press conference will take place at noon today. Thank you.